some of the clinical implications of closed chain exercise. So we're going to be looking at an improvement in stability because we're going to have a lot of co-contraction with closed chain exercises. Because we're doing weight-bearing exercises, it's going to improve proprioception. So it fires the mechanoreceptors within the joint itself, which helps to improve stability, or helps also improve joint awareness or proprioception. And then it can also facilitate the reduction of pain or help to modulate pain by firing those two type 2 and type 1 mechanoreceptors. So we've talked a lot about how closed chain exercises are more functional, so you want to be sure to include them. So a comprehensive exercise program includes closed chain exercises. If you stick with just isometrics or open chain exercises, you're selling the patient short on all of the type of contraction that they need to be able to perform in functional activities like work or home related activities. Here are just some guidelines for progression of closed chain exercises. This slide is important and you should understand this because you are going to be asked on how to progress closed chain exercises. So if you're looking at static stabilization, so that means activities where you're standing still and doing activities versus dynamic. So you could do a long arc quad or seated knee extension, and that's static exercise. Or you could do a squat, static exercise. You are lowering down, but your feet are staying still, versus walking lunges or alternating lunges is more dynamic. A stable surface, so a level surface, and then progressing to either a BOSU, an AirX pad, a fitter or balance board, so that's an unstable surface. Single plane, so staying in frontal or sagittal plane versus crossing multiple planes. So these are our diagonal patterns. Wide base of support and then gradually narrowing it. So a wide base of support, so wider than hip width, both feet are on the floor, narrow that up, and then a progression of a smaller base of support would be single leg, one foot on the floor. And then going from no resistance to resistance, stabilization of motion for or resistance throughout the range, doing alternating challenging activities, so again crossing planes, that bilateral support, so this is another way of saying our wide base of support to a unilateral support or a narrow base of support. Consistent movements versus perturbation training, and perturbation is just a fancy way of saying that you're trying to provide patients with outside forces that are trying to push them over at the same time. So they're doing an exercise and they have to maintain that while you're trying to give them resistance from a lot of different directions. So this slide here is very important to remember. When we're looking at closed chain equipment, so there's a lot of different equipment that's out there. You may be familiar with some or haven't really seen any, but we're looking at exercises that can be done in weight-bearing positions for closed chain. And all of these equipment or these exercises are going to help to improve strength, endurance, and stability. And it can be done, again, going back to that previous slide, from wide base of support to narrow base of support, stable surface, unstable surface. So we have the total gym. So we have one in our lab that hopefully one day we'll be able to use again. But we're looking at the total gym, and based on, so this is the Chuck Norris infomercial tool. So that different angle puts gradually increases the weight. So the flatter the angle is, the less amount of body weight that you have. So if you're doing squats, you'd have both feet on the platform. At a lower angle, has less weight on the feet, on the lower extremities, and then as you increase that angle up, you're gradually increasing the amount of weight that you're putting on the joints. You can do open chain and closed chain, so there's different tools to where we can use it to do like rowing, simulated swimming stuff. We can use it to plyo. You can hook up the BAPS board onto the platform. So again, it just helps control how much weight is getting put on the lower extremities. Some other tools that are out there are the fitter and the BAPS board, wobble board, or a different balance board. Some of you may have seen the BAPS board that we have. So this biomechanical ankle platform system. And in our lab that we'll hopefully start integrating pretty soon is we'll see that in use, and we can change the angle of how the ankle is being used, can change if it's focusing more on dorsiflexion or plantarflexion, inversion, eversion, but all of this is weight-bearing exercises, closed chain exercise. Some other alternative equipment, the mini trampoline, ellipticals, slide boards, stepping machines, all of those are closed chain exercises. This is when you can kind of get into some of that debate when you're looking at the elliptical or this, the elliptical, both feet are fixed on a platform and they're moving in reciprocal motion, as opposed to a step machine where one foot comes off the step and goes up to the top step, so that you have, it's alternating closed chain, open chain, closed chain, open chain, versus the elliptical, the foot is fixed on a surface. So that's where you can get some of that different opinions on closed chain and open chain. This is another slide that reiterates progression of closed chain exercises. So make sure that this one you can use as well as that slide a couple, 2-3 slides ago regarding progression of closed chain exercise. This one includes eyes open versus eyes closed, especially when we're looking at balance exercises, because using our vision is important in maintaining balance. So you could have a patient or an individual that's maintaining static balance, eyes open, narrow base of support, but once you close their eyes, they sway all over the place. So you might go from narrow base of support, eyes open, to a wider base of support with eyes closed. So instead of adding too many variables at once, control it. So focus on, if you're going to change eyes open versus eyes closed, then regress on base of support. So I'm progressing the patient by going to eyes closed, but I've regressed in their base of support in having a wider base of support or using the parallel bars or an assisted device. And we can talk about that more in our discussions.